One of the things you'll notice when you go to an ophthalmologist's office most of the time is there's no kids there. You look around and people who get cataracts, people who get glaucoma and macular degeneration are typically older patients. So it's not that common for ophthalmologists to see kids. This is typically missed in smaller communities and rural communities. In a population like the Mohawk Valley, there are not a lot of ophthalmologists who will see pediatric patients. My brother and I grew up here. Dr. Buschinger, who works with us, grew up here. We see kids because we raise families and we understand what it's like to have a kid with a problem and to have to travel to Syracuse or Rochester and spend an hour in the car and then go to an eye doctor's office and have your child get drops and wait in a waiting room. It's a challenge. It's a challenge for most parents. A lot of the pediatric eye problems are simple. We're trained for this. I spent a good portion of my residency in ophthalmology training working with kids and their diseases and performing surgery on children. And we enjoy it. We enjoy it. Myself, I had a number of eye problems as a kid and even surgery as a child. And that was a scary time. I remember being nervous and being uncomfortable and having doctors shine lights at me. So I enjoy it. I enjoy spending time with kids and treating them. Some of the most common things that we treat in our pediatric patients are as simple as nasolacrimal duct obstruction, which is usually a baby or an infant or even a toddler with a tear duct that doesn't drain properly. And that's usually a relatively simple evaluation and procedure. We sometimes just probe the duct, sometimes we put a tube in there, sometimes we dilate the duct. It's a very common procedure that we treat. One of the most common needs for surgery in pediatric eye patients is strabismus surgery. Strabismus surgery is surgery to realign the eyes. So an eye that's crossed, an eye that turns out towards the ear, requires sometimes just glasses, sometimes patching, and sometimes surgery is necessary. As an early child, this is something that is worrisome for parents. When the child gets into their teen years or adulthood, sometimes this is something that can make the child feel different or notice themselves as being different. And it's a great thing to be able to straighten someone's eyes. It's one of the procedures I enjoy the most because it makes such a difference in the child's life and the parent and family's life. And it definitely gives them a different feeling of how they feel about themselves. So we do strabismus surgery in our practice. Most of the time, pediatric eye exams are done by a school nurse or a pediatrician. They go over to the chart, they cover one eye, and if they can squeak their way down the chart, they get by. And one of the things we do when we examine kids is we put a colorful patch or tape over the eye, or one of our technicians is covering the eye so the child doesn't peek around the occluder. And this is commonly done by kids. Kids want to pass a test. They want to have good vision. They want to get it right. So a careful pediatric eye exam is important. The last thing that we want to do, and certainly something that we can't do, is miss a sight-threatening condition in a child.